Today topic is implantable drug delivery system. First of all, we have to study about the introduction advantages of the implantable drug delivery system and some basic concepts of the osmotically controlled drug delivery system can be studied in this implantable drug delivery system topic. The basic concepts of the implantable drug delivery system contains drug, osmotic agents, semi-permeable membranes, plasticizers, flux regulators, wicking agent, pore forming agent and coating solvent. These are the some basic osmotic pumps which control the drug delivery system by osmotically. And in this implantable drug delivery system, we are going to study about the different types of implantable drugs. Concept of the implanted osmotic pump, how it works, what is the function and what is the advantages of the osmotic pump. It can be studied in this topic. The more efficient drug delivery strategies to treat the adolescent diseases and rise of the micro and nanotechnology have led to development of the more sophisticated drug released implants with the improved capabilities and performance for localized and controlled therapies. In recent years, implantable drug releasing system has emerged as an outstanding alternative to conventional clinical therapies. This new breed of implants has shown promising capabilities to overcome the inherent problems of conventional implants. These therapies and making clinical treatments are more efficient with the minimal side effects. In recent clinical trials, which have demonstrated that the technology that improve the life of patients and increase the life expectancy. An implant is defined as an inert device that replaces a fraction of host body for repair and support. Other concepts such as implantable microchips, capsules, micropumps, wafers, and patches can be considered as temporal implants. The function of the which extended over a limited period of time due to the technical or therapeutic reasons. Depending upon the release performance, drug releasing implants can be classified as passive or active implants. The release of drug cannot be controlled after implantation, and the drug releasing performance is established by the material composing of implants. The drug formulation in the latter, however, the release of therapeutic is triggered by the external stimuli. The benefit obtained from the drug releasing implants in clinical applications can be numerous, albeit they are susceptible to generate the problems such as infections, inflammations, lack of integration within the surrounding tissues. And these fatal incompatibility or total rejection which imply further surgery and replacement of the implants. The most important properties to be fulfilled by a clinical implant are sterility to the biological environment, To prevent the body from bacterial infections and integrations within the organic tissue, these implants are used as a supportive system. Apart from these standards, in terms of biocompatibility, drug releasing implants must deliver the therapeutics in an optical manner which under in vivo conditions. The performance of the incompatible clinical devices is periodically received after controlling the most recent developments and success failure reported worldwide. This is about the introduction of the implantable drug delivery system. The main advantages of the implantation drug delivery system are: it improves the drug delivery within the body. For example, the drug moiety by passed by the gastrointestinal tract or by the liver. So this is improve the drug delivery of the dosage form. By this drug delivery system, the therapeutic values will be increases. So that's why these implantable drug delivery systems are mostly used. Another advantage is by allowing the reduction or elimination of the patient involving dosing, the compliance will be increased hugely. It means the patient compliance will be decreased by these by the use of these implantable drug delivery systems. The drug will be released in potential form for the controlled release of the drug usage. And another advantage of this implantable drug delivery system is bioresponsive release from the implantable area on going research. The flexibility of the implantable drugs will be shown in this implantable drug delivery system. So these are the some types of advantages. They are easy drug release and improved drug release. Compliance will be decreased and potential controlled release of the dose can be observed, and flexibility of the body can be seen. These are the some advantages of the implantable drug delivery system. While implantable drugs having advantages as well as having disadvantages also, they are invasive. These therapy this therapy procedure is invasive technique because it takes a lot of time to implant the drug into the body. So it takes a lot of time. It is time taking procedure, and sometimes the device can be failed by the some external conditions or biological conditions. So that's why this is not more effective drug delivery system dosage form. And these osmotic pumps and non-biodegradable polymeric implants also surgically recovered at the end of the therapy. So that's why the surgical recovery is not required in the biodegradable polymeric implants. This is the main disadvantages of the implantable drug delivery system. The limited potent drugs can be implanted through this implantable drug delivery system. All drugs cannot be implanted into body, so that's why it is a main disadvantages of the implantable drug delivery system. A high concentration of the drug delivered by the implantable device at the implantation site, it produces some adverse effects. This is also a major adverse disadvantages of the implantable drug delivery system. This is about the advantages and disadvantages of the implantable drug delivery system. After that, basic components of the osmotically controlled drug delivery system, or also called as osmotic pumps. What is the basic components of the osmotic pumps? Here we go. Drug. Both water soluble and water insoluble drugs can be used in the osmotic pump. The drug candidate used in the osmotically controlled drug delivery system should possess the biological half-life, high potency and low potency of the drug can require a chronic treatment. The ideal drug candidates which can be used for the formulation and evaluation of the osmotic pump drug delivery systems are antihypertensive agents. The evaluation of the osmotic pump drug delivery system are antihypertensive agents. They are nifedipine, virampil, metoprolol, captopril, diltiazem, hydrochloride, cardiol, valsartan, diabetic agents, non-steroidal anti-inflammatory agents, ibuprofen, diclofenac, sodium acyclofenac, etc. These are the some drugs which are cannot be implantable through these implants. Osmotic agents usually are ionic compounds which contains of the either inorganic salts such as sodium chloride, potassium chloride, etc. These sodium carboxymethyl cellulose and hydroxypropyl cellulose are additionally sugars such as glucose, starch, sucrose. These and inorganic salts of the carbohydrates can also act as the effective osmotic agents. These osmotic agents are used for the fabrication of the osmotic device maintaining concentration. By the osmotic device maintain concentration gradient which across the membrane by generating a driving force for the uptake of water. It maintain the drug uniformity in hydrated formulation. Drug is the basic compound and osmotic agents also the basic components of the osmotic pumps. And when we move to the semi-permeable membrane, the semi-permeable membrane plays an important role in the modulation of the drug release from the osmotic drug delivery system. It should be stable to both outer and inner environment of the device. The membrane should be rigid and inert. It maintains dimensional integrity to provide a constant osmotic driving force. During the drug delivery system, this semi-permeable membrane is working as a basic compound which the drug passes from the semi-permeable membrane to osmotic drug delivery system. This semi-permeable membrane is a membrane which works as a basic component for the osmotic pumps. And plasticizers are used for the coating membrane during the formulation of the osmotic system. And some flux regulators are designed to regulate the permeability of the fluid by incorporating the flux regulating agents. And a wicking agent is defined as a material with the ability to draw the water into porous network of the delivery device. These wicking agents are either swellable or non-swellable in the nature. The function of wicking agent is to carry water to the surfaces and absorb the molecules.